I will now demonstrate the assessment of entheses that are assessed in the Maastricht Enthesitis score, or MASES for short. And in order to do this, I will first begin with the evaluation of entheses in the pelvis and the lumbar spine. So I'm going to ask Whit, if you could turn to face in this direction. And I'm going to first of all locate the anterior superior iliac spine. In order to do this, I'm going to find the iliac crest and to follow the superior aspect of the iliac bone anteriorly until one can locate the bony prominence of the anterior superior iliac spine. I'm now using my index and middle finger to exert pressure on the anterior superior iliac spine. Okay, Whit, could you tell me if you experience any tenderness on either the left or the right side with me exerting pressure now?
No.
No tenderness on either side. What we will do now is follow the iliac bone, the superior aspect, till we reach the iliac crest. Now I'm exerting pressure over the iliac crest with the index and middle finger. And could you tell me, Whit, whether you experience any tenderness on the left or the right side when I exert pressure now?
Both sides. Left and
Both sides. Okay. Could you turn round? And we will now continue the examination of the pelvic entheses, following the iliac bone until we reach the posterior superior iliac spine, which is located at the dimples of Venus. So beginning on the right side, going to exert pressure. Can you feel any tenderness when I exert pressure?
No.
The answer is no. We're going to do that now on the left side. Do you feel any pressure when I exert tenderness on the left side?
No.
We're now going to move to the assessment of the fifth lumbar spinous process enthesis. And this is located just above a horizontal line that joins the two dimples of Venus and is located in the midline about 1 inch superior to that horizontal line. To enable detection, I'm going to ask Whit to bend forwards about 30 to 40 degrees so that I can more readily locate the spinous process. Very easy to feel right now, and I'm going to exert pressure. Please tell me if there is tenderness.
Yes.
The patient reported yes. Now, if you could take a seat on the examination couch, Win, and what we're going to do is evaluate the costochondral junctions, particularly the first and the seventh, in the chest wall. We're going to do this on the left side. Now, the first costochondral junction is located by finding the clavicle, and just below the clavicle and its articulation with the manubrium is the first costochondral junction. So this is located lateral to the manubrium, just beneath the clavicle. This is the clavicle. This is the first costochondral junction. So I'm now going to apply pressure at this location, sufficient to blanch the nail bed. Please tell me if there's any tenderness.
Yes.
The patient reported yes. And then we move on to the evaluation of the seventh costochondral junction. And we begin with the suprasternal notch, which is located right here. And as we follow inferiorly to the bony ridge that represents the manubriosternal junction, just lateral to that is the second rib. So I place my two fingers over the second rib. Below that is the second intercostal space. Below that is the third rib. Below that is the third intercostal space. Below that is the fourth rib. Below that is the fourth intercostal space, and below that is the fifth rib. Below that is the fifth intercostal space, and below that is the sixth rib. And then below that we have the sixth intercostal space, and then the next rib is the seventh rib, and the costochondral junction is located in the mid-clavicular line. So my thumb is now located directly over the seventh costochondral junction on the left side. I will now exert pressure sufficient to blanch the nail bed. Please tell me if you have any tenderness.
Yes.
The patient reported yes. Now if you'd like to lie down with, we're going to evaluate the Achilles tendon and the plantar fascia. I'm going to demonstrate the evaluation of the Achilles tendon insertion into the posterior aspect of the calcaneum. Slightly dorsiflex the patient's ankle and locate the Achilles tendon and follow it to the proximal insertion into the posterior aspect of the calcaneum. I'm going to apply firm pressure sufficient to blanch the nail bed. Is that tender? The patient reported no. For the evaluation of the plantar fascia, I'm going to use the knuckle of my index finger, and I'm going to apply pressure to the inferior aspect of the calcaneum and the antero-inferior aspect. So in this location, I will apply pressure. Is that tender?
Yes.
The patient reported yes. That completes the evaluation of the tender and theses. The examination should be completed on both sides, and this will result in an evaluation of 13 tender locations.